I think we're live. I hope we're live. I hope that people on LinkedIn can see us. It's our first time. There might be some technical issues, but we're going to get through this. We don't gatekeep ourselves here. Hello, fam. Welcome to another sorry. You see, since I'm live, y'all get to see all the mistakes that we make while we're recording. But welcome to another Hope, Power, and Healthcare with Melissa and Chris. And we're gonna do something a little bit different for our intro. We're gonna introduce, because we're talking about this subject of going against these larger competitors and big behemoths in a heavily regulated and difficult industry. Melissa and I cooked up a little skit that we hope you can relate to before we jump into it. I'm gonna play the part of a salesperson. Melissa is going to be a decision maker at a major payer. And Melissa, you ready for it?
Yes. If it goes really well, this was Chris's idea. If it goes really poorly, it was Chris's idea.
I like it. Now, give me 1 second. Okay, so confirmed, we're live, so everything is working hunky-dory. So, me, the salesperson. Hey, Melissa, and thanks for setting up this call. I've added my boss, their boss, our head of product, her cousin, also George Clooney, and I've added our CEO, who's dialing in from Germany. It's 10 at night there, but we're ready to roll. Thank you for setting up the call.
Well, Chris, I usually bring my cast of 1,000 as well, but today I wanted to connect with you because we're actually going with your largest competitor, which is called Meglasoft.
Wait a minute. In our chats, you said that they were nowhere near what we were doing for the solution. What happened?
Well, Chris, I actually wasn't your official decision maker on this. I conferred with a department that you normally have to work with for over 100 days, and they suggested I go with a different vendor.
Well, knowing that like it was out of your hands and you're working with this different vendor, I'm just wondering, like there's still that gap that our solution can fill. Is there a chance that we can rev up another opportunity soon?
Well, I will next be free in probably 9 to 10 months. Would you like to try me back then? I may not be in my role any longer, but still call me. I might be, available.
Y'all, I know that we're not necessarily Juilliard trained actors, but we wanted to bring hopefully a relatable situation that you've already seen and probably will see if you're building and innovating in healthcare. So the real point of this story is that as you're building these innovations and as you're going up against these market challenges and difficulties and long sales cycles, you're focused on driving growth, equity, and savings, but it doesn't have to be like this. It doesn't have to be this scenario where it feels like a constant slog against these larger players. So we're dedicating this episode to innovating in a space that's highly competitive with industry behemoths that have deep pockets, massive teams, and powerful relationships. Melissa, can you kick us off on the show, and I'll introduce Kathy?
Yeah, for members of our fam who haven't joined us before, I'm Melissa Riley, and I am so fortunate that after many, many years working at 3 different payers, I now lead an innovative consulting company called Stealth Consulting. I'm joined by my fabulous co-host, Chris Hempel, who's been developing AI healthcare since 2018. And now is the leader of Modular Feedback, which focuses on healthcare data science and AI that helps companies position themselves for growth. I am so lucky to be able to collaborate with Modular Feedback. And we have a guest co-host today. Kathy, can I turn it to you to give an overview of your background and maybe a little bit about your company?
Sure. Hi, everybody. I'm Cathryn Connolley. I'm the CEO of Doctivity Health. We are a business intelligence physician relationship management tool. We are a SaaS product wrapped with customer success and a management services team. We've been in business since mid-2022. But my background, my healthcare background, I spent 14 years inside Geisinger when Dr. Glenn Steele was the CEO, and I held the position of VP of Marketing Strategy and Operations. It's nice to be with you.
It is so nice to have you. And Chris, can you tell us how you ran into Kathy? How did you two become friends?
Folks, there's a issue that I just had a technical issue, and it's saying that we were not live yet, and now are are we to mean that people may have missed this skit? 1 second. Okay, now we are truly and officially live. Sorry about the technical issues, folks, but we're here. You missed our skit, but you'll be able to see it on the recording. Now, just to quickly recap, our conversation today is about being healthcare innovators, operating in our small environments, the small Millennium Falcon going against the Death Star and these gigantic institutions. How do we position ourselves? How do we position for success in this type of market? And it's so exciting. We've got Cathryn Connolley here, who's the CEO of Doctivity, which is a SaaS platform that's 3 years young in a highly competitive environment, going against these larger competitors. And what we're going to do is dissect what that market focus is, how she engages and interacts with C-suite and users of the product. And Melissa, anybody in the fam knows, we're talking decades of experience with the largest payers, working directly inside health plans, now consulting and helping to lead startups. And myself, I'm more on the analytics and data science realm, but now developing and building data science and AI-driven solutions focused on health equity and enabling healthcare as a whole. But with that, Kathy, 14 years of experience at Geisinger, 8 years advising for major strategy at Geisinger, MedStar, and others, and now the founder of Doctivity. Could you just tell us, just give us some background on that transition from leadership at these major institutions to now founding a SaaS platform?
Sure. So when I was inside Geisinger, I managed a team of about 70 people, and we were responsible for marketing strategy. I had the physician relationship management team, physician liaisons reporting to me, and it was all about, we were recruiting about 160 new docs a year. So I was tasked with getting them ramped up to that break-even point and ensuring retention and that their caseload, they were seeing the right cases, and then growing market share, as well as being able to identify the referral sources, and also making sure there was no out-migration happening. So we put together a product, and at the time, it was taking almost 24 months for new providers to ramp up and break even, and it was really a drag on the bottom line. So we put together this product, and within the first year, we took it from 24 months to 9 months on average, these new docs to ramp up and break even, which saved the organization close to about $20 million, and that's without any downstream. And then year 2, it went from 9 to 6, and then we leveled off at about 4 months. And the program was really successful with the new providers, and then we rolled it out to the currently employed underperforming to ensure that they were hitting their productivity levels and that they were seeing the right cases, the referral sources, the ones that were splitters. So it was a very focused approach. And then and this was over the course of about 5 years. And then when Dr. Steele had announced he was leaving, I left Geisinger and started a boots on the ground consulting business that really focused on the same type of products, solutions. And it really was me knocking on doors, with organizations that I had developed relationships with. And from there, we started to realize that there was such a huge need for this type of work. And then knowing and seeing the amount of data that was out there that wasn't being used strategically to grow business and accelerate new revenue generation. So we at one point we decided to pivot and develop the platform. We had investment from 2 VC groups, completed the software solution. We went back into Geisinger with the Musculoskeletal Institute with Dr. Michael Sook, and we were fortunate enough to be able to beta test the product there. And we drove an enormous amount of new revenue and solved some of his major operational issues at the time. And, you know, with that validation and that beta test, we were really off to the races. I knew that there was such a need, and the fact that the amount of revenue that we drove, I guess is a better way to put it, I knew that we could commercialize it, or I could commercialize this. And if we were having these issues inside Geisinger, they had to be having them elsewhere. And, you know, proved that. And I pulled a couple of my team members, my core team members, as I started to land some business, they jumped on board, which was, you know, there's a lot of change happening in healthcare at the time. So they joined me, and, you know, it was all about the team. But it's one of those things. Do you want to continue to do what you've been doing for years? And there's nothing for me. I loved my job, but it was time for a change. And, you know, I was at a point in my life where if I was going to take the risk, and there is a lot of risk, that was the time I was going to do it.
Oh, I was just going to say that there's a lot of really powerful Lego pieces here. And it's really impressive that you were able to spend these years consulting with multiple major healthcare players, and then get that deep understanding of a major problem to solve.
And, you know, Chris, absolutely. And I was fortunate, and, you know, another really important piece of the Doctivity story, my story, is the fact that it was all about relationships. So my time at Geisinger, you know, I never burned a bridge, and it was a huge organization. And the leaders that I worked with, they too left and moved on to become, you know, CEOs, CFOs, COOs of other organizations. So when the time came for me to knock on their door, you know, they knew the work that was being done. They knew the value that was driven when I was leading the product. So, and they gave me a shot, you know. And I'll say that the other thing, people ask me, you know, you went and knocked on their door, or you reached out, or, you know, I'm a big believer, if you don't ask, you're never going to know, right? And I know that sounds so simple, but at the end of the day, it's the truth. And all that can happen is somebody to say no. You know, my team can handle it. Not interested. But that is, and the other thing, you know, I say this often, is you have to be comfortable with being uncomfortable, period, in this space. And that's all there is. You know, you're making it happen.
That's right. Melissa, I've learned so much from you about being comfortable with being uncomfortable. I want to shout out to Trina and Valerie in the chat, Trina Histon and Valerie Hoffman, because they're getting the conversation going. So Kathy, she's up here. The reason we set this up is not just for us to talk, but we'd love if you have questions about Kathy's story or challenges that you're facing that you want answers to. It's consulting that doesn't cost over $500 an hour. Like she's on the hook to answer your questions for free. So any questions that y'all have, or just in the chat, let us know anything that you're looking to learn today, and I'll try to figure out how to work it into the conversation.
You know, I'll start by saying the fact that it was beta tested inside Geisinger helped a lot. And with Dr. Michael Sook, right? He's known nationally. So that helped. And I was always tasked with having to show ROI, return on investment, for whatever I was doing and the programs that I was building inside Geisinger. So I was very used to that. So putting rigor around the results that the platform was delivering and that the customer success work. So our product is the SaaS, it's business intelligence, physician relationship management tool, and it's wrapped with customer success services, so strategic services, which in today's market, my belief is it's so important, because when I was signing contracts for $2 million software systems or whatever it may be, the software would be implemented and they'd say, basically like, good luck, and we would never get the real value or that return. So that just stuck with me. So with Doctivity, we are driving ROI back to our customers, where we're paying for ourselves within 6 months. And so being able to have that rigor, the calculations, and those use cases to show the customers when we're going up against the giants in the market. And I call it let's do the Pepsi challenge. Once I get to the C-suite, once I get to the buyer, and they've been using the same tool for a long time and they're not getting those results that they want or need, I just, again, it's if you don't ask, you don't know. So I'm always asking, let's just do the Pepsi challenge. And if we don't hit the results that you need, we'll move on. We'll call it, we'll just call the ball. So when we do the Pepsi challenge, 95% of the time, our output, our analytics, our data delivers exactly what the buyer is looking for.
And like the ability to even do that Pepsi challenge, what are how many people are on your team?
Now that is a loaded question, Chris. We have 12 FTEs full time, and then we use some independent consultants, but that's where we're at.
So we're talking about a small team. We're talking about under 50 people, but still being able to navigate and outmaneuver some of these larger organizations. What helps y'all get that positioning to be able to deliver the types of deliver on the ROI expectation and explanation for these sophisticated institutions?
You mean to get the shot with the C-suite?
Well, when you were talking about that growing moment of being able to show that ROI growth and deliver on it, I'm just curious about how the team orchestrates that and some of the hurdles along the way.
So, our platform, we do micro use cases. So we know already going into an organization when we're in the consideration set, we understand what their pain points are. So through our tool, we can develop a micro use case, which would show very clearly if it was they're looking at a secondary market for orthopedics and they need to drive more referral volume, right? If that's their pain point, in our tool, we can clearly show exactly where those opportunities are. There's an ROI calculated if 50% of those referral targets switch and start referring to, let's just say their hip surgeon. So within a couple keystrokes, you can see exactly what needs to happen. And, when I was running the department inside Geisinger, it would take 8 months for us to get that kind of data and pull that kind of strategy together, because we were getting data from all different software platforms. That was another reason why we developed this product. But even more important is the network that you have. And, I set up a advisory board for Doctivity. We have a fiduciary board, and then we have an advisory board. My advisory board is stacked with people who I worked with over the years in different capacities. But, Dr. Glenn Steele, he is the current chairman of the board of City of Hope. He was my CEO inside Geisinger when I was there. He's the chairman of my advisory board. Dr. Stephen Strongwater, he's been a CEO in a number of different healthcare organizations. I worked with him when I was inside Geisinger and kept that relationship going. Gene Hitchcock, that's how Chris and I met.
Shout out Gene
Gene,
Hitchcock.
yeah, shout out to our girl. She's she's a giant in healthcare marketing. She is the queen of physician relationship management. And Gene and I have known each other for over 25 years. And, I wouldn't have Doctivity if it wasn't for Gene. And so she's on my advisory board. So we just have a number of industry leaders who I've been able to pull. And at first when you're starting out and you don't have client number one or customer number one, they'll say, yeah, I'll give you a reference personally, right? But I'm not ready to put my name on that product because we don't know if you're going to be able to sell it. But as you continue to land customers and you retain your customers and you show that ROI and the value and you get references, then it's, you can use my name any way you want, right? I'll make phone calls for you. I will go to meetings with you. And it's truly, I've leaned into my network, which has been the number one way we've gotten sales. And then references from our current customers.
That's a fabulous way to frame it, because my question was kind of, hey, what did you do? And like were there some certain features or technology that you built? But no, we're leaning into a network, and you just reemphasize a point that we want to make by even having this podcast and having this show, is that you're not alone, and you shouldn't try to do this alone.
And I'll say this too, like I say we a lot. The we is my team. And, there are a couple people who've been with me from day one. Haley Coombe, who is the VP of operations. I mean, she's fantastic. And she's just tremendous. Anybody who meets her loves her. And I'm lucky to have her.
Can confirm, have spoken with Haley, Olivia. If y'all are watching.
Oh, yeah, Olivia's terrific. Olivia, Sean, the whole group, Justine. It's an amazing group of people, and they come from a very different background. Like Justine, she was in operations. She's a nurse. She's a master prepared nurse, and she manages our customer services, customer success. Sean, he worked with me inside Geisinger. He ran the physician relations department for me, and Sean is. He has, spoken at many different national conferences about the power of physician relations. So it's a great group of people.
When you outline this story and these hurdles and roadblocks to getting that level of engagement and finally crossing that chasm, it makes me like, I didn't write this question down ahead of time, but I got a question for both you and Melissa. I'll start with Melissa. Actually, is like, from what you're hearing from Kathy about what people should be prepared for in this commercializing journey, how does that line up with what you're seeing, like working with the basket of innovators?
Yeah, great question, Chris. And it's so fun because I never think anyone is prepared for this journey until you actually go and do it. Because I think anything you expect is going to happen probably will and more. And it's those unplanned things that you're not thinking about just because you haven't had enough cycles out there to say, well, what happens when I've got an issue with like a vendor, or maybe I've never negotiated a payer contract. I've been on the other side of it. So it's just this incredible learning journey, but it goes back to getting really comfortable with just being
That's
uncomfortable and not having all those answers in front of you, but knowing you're surrounded by this beautiful community. And I hear Kathy kind of reflecting on that, of people that are willing to like lean in and help you. I had a founder this past week that took the time to help another set of founders. And I just love that. I see that all the time.
Yeah, I would agree completely. And, the one thing that Haley and I talk about all the time is there's no game plan for this, right? So you're creating, and I hate to use this because it's overused all the time, but, we're building the plane as we're flying it. And you are just re-engineering and innovating every single day. From your messaging to your presentations, to how you're using the platform. For us, the platform sells itself. That's the easiest part, right? But it's all these other things that we're talking about. It's once you get your investment, then what? Because you absolutely have to sell and perform and drive the ARR, or it's game over. So the pressure is enormous, and if you're not good with managing risk or the unknown, it's not for you. It's not for the faint of heart.
So when I
It's like you're building that plane while flying
Yeah.
it after you just jumped out of a plane and continue to jump
That's
out
it.
of the plane again and again
That's
and
it.
again. And Kathy, as we're experiencing all this craziness, we had a question from Peyton in the chat, and she said, what advice would you give for keeping the human side of leadership front and center? And we think about that in that very dynamic plane jumping environment.
Yeah, I'm a big proponent of team, like I said, and managing with understanding and empathy, even though there is so much pressure. You have to, we learn together, and when things don't go the way you want, you fail together, right? But man, oh man, when you do get a contract that signs, it's the best. And we just, the team is the most important thing for me, for where I am, for our trajectory and our growth. It's the management team. Everybody has everybody's back. We do a lot of work on trust, team, moving forward through adversity, and to overcome certain things. We do a lot of work around that.
I think that you struck a chord with the audience when you said we're building the plane while flying it. Tyler Brown in the chat actually said the exact same thing to his team recently too.
Mm-hmm. For sure. It's like when you go into this, when I went into this, when Haley and I, we weren't salespeople, we were relationship people, right? I mean, you don't move up in your career, you don't, expand your network if you can't build relationships. So that I could do, but in terms of sales, when I started the boots on the ground, you learn real quick. But I wasn't trained to be a salesperson. So just figuring that out. And, but yeah, it's just very interesting. And that is the best analogy, building the plane as we're flying it. Well, and Haley runs our product division, product advancement division, and Haley was a manager inside Geisinger on my team. She was just great with people, great with project management. She was really good at software applications, and now she's going to be talking to Chris about some AI, and we're rolling out a whole new AI functionality, and she's learned all of those skills in the last 3 years.
So we want to zoom in on the story then, because you're building the plane while you're flying it. I really relate to you having to figure out sales on the go and bringing your own perspective to it. So Melissa and I were wondering about if there's a story where you went up against against all odds, and were able to, you went up against one of these big behemoths that we're referencing in the show's title, and were able to get that win against all odds.
I would say that because we being the team, and we're healthcare insiders who built this analytics platform, and because that was our approach, we weren't IT people, data scientists, software people developing a platform for a need they saw in the market. For us, it really made a difference. So, the software companies have great sales teams, but at the end of the day, when we're doing the Pepsi Challenge, understanding the pain points and what the buyer is currently going through, it matters, because I can relate to it, my team can relate to it. We know we've lived what they're talking about, and for a long time. Many people on my team have been in operations, in BD, and M&A, and finance inside large health systems for 20 plus years, so they know, and that has made a big difference.
Yeah.
And it's getting to the point where when we do go head to head with some of these big guys, now 3 years in, we're 3 years young, as you said, Chris, but we're starting to get like, who are these guys? Who is Doctivity? And because we're winning some, which is super. It's a real David and Goliath story, period.
And I wonder if because that's a really powerful way to think about it, is there's like when someone is trained and pedigreed in sales, then when the conversation starts, like, I get a message, I know it's kind of this BD type thinking, and then they're going to ask for a discovery call and everything like that.
The sequencing and all that stuff.
But yeah, it seems much more powerful to be able to come from it with deep experience and knowledge, passion in that field, and that seems to be what fuels people to continue engaging and grow their relationship with Doctivity.
For sure. And right now, it's just, the other piece about all this is just having a little bit of luck. I mean, truly. Our product solves business advancement and accelerates new revenue. And right now in the market, every provider segment needs just that. And so it's our tool is very innovative or intuitive, to use, and it's also innovative. But what we deliver is working well right now for organizations, provider organizations, who need to understand what levers to pull to keep their providers, to be able to recruit the right providers, to understand what's happening in the marketplace at the provider level. And, that's where we really excel.
So seeing this growth and knowing where you started rising, stumbled a bit, then kept on going, what would you go back in time? We have a little time machine here, and we're going to give it to you and let you go and tell past Cathy a piece of advice that would change the trajectory.
I wouldn't have been, we were very, that's a really good question. I don't know how to answer that. Be selective on, where you're getting your money if you need investment.
Ooh, can you tell me more about that one?
Well, there's a lot of different options out there. And some of them are very advanced in how they support their portfolio companies, right? They have actual ramp-up programs. And, I get calls and people ask me, how did you ramp up Doctivity? And I think, boy, if there was something like this in place when we were starting, which gave you, here's what your trajectory should look like, here's the roadmap, here's, just, but we were so busy just trying to, get the product off the ground. My biggest piece of advice is be very selective on your team, of course. The team is everything. And it's like we said it earlier, you got to be comfortable with being uncomfortable and do the work. And, don't be afraid to pull out all the stops and just ask for what you want.
I want to zoom in just for the fam, for people newer in the space and things like that. All that glitters is not gold. Though when you said be selective about where you get your dollars, I felt that because we're in healthcare. Healthcare has unique sales cycles, expectations, levels of expected service. Like a lot of venture capital cringes at the term managed service, but a lot of that has to be how you deliver within healthcare.
Sure.
Yeah. So.
And, that's really resonating right now in the market. Like some of the big organizations are now building these customer success arms so that, I think they're seeing we can't just plug in our platform anymore and roll because people are, exercising their early out clauses, so it's that the market has changed. So just, be smart.
Melissa, I can't believe you came back smiling after wrestling with that awful Wi-Fi. Glad to see your smile back on the chat.
I was swearing, but no one could hear me. It was good.
Well, you made it back just in time. Cathy dropped a big wisdom bomb for any innovator out there, is to be careful about who you're getting your money from, like partnering with the right capital and sources of funding. I wish you were there for that part, but at least you're back for the pop culture section. You want to kick that off?
Yeah, so Cathy, we love to play pop culture, which is where we ask our guests, what are you listening, watching, reading, or just what's going on in the space that excites you? For me, I am loving a little bit of more quality time with my daughter, and we are watching The Summer I Turned Pretty. And the piece that really resonates with me is these relationships that exist and these friendships that ties so nicely into the point you made around, choosing your people wisely, and those are the people that build with you. I love that part of the story. These are like lifelong friendships. So Cathy, we'll popcorn over to you. What are you enjoying in the pop culture scene this week?
I know everybody will be like, "Oh my God, Conley, you're way behind." But so Ted Lasso is a big one. And I'm looking forward to the next season, I guess, is coming out, and just the way there are so many learnings if you pay attention to Ted Lasso and the shows. But one of the things that that resonated with me was the episode where he's playing darts and he said, I've always been underestimated. Everybody's always underestimated him. And that really resonates with me and, my management team. They're scrappy. And, we have been underestimated. But everybody, will outwork. And, we were just talking about that the other day. But yeah, so Ted Lasso is something that I'm really enjoying getting caught up on.
I like where you're coming from with that. I think before the call you said this is not for the faint of heart, and what you just said emphasizes some powerful toughness that I want to try to imitate. And since we're limited on time, I'll just jump in with mine. I have a couple. One, I think you should go. Anybody watching should go on Spotify and follow the Hope, Power, and Power in Healthcare playlist. We put together songs that we are inspired by, our guests, and that has gotten me through some crazy difficult runs. So that's one thing in pop culture. But the other thing is The Pit. We've talked about The Pit on the show before, but I just started watching it a couple of weeks ago with my partner. So my partner Shay is an OB-GYN at Henry Ford Health System, and I have to tell you, when she is sitting there watching it and experiencing the way that they portray it, the fact that you're looking at just one shift, you're looking at just 1 hour of a shift in each episode. There's a whole lot where she's like, Chris, this is what I wish you could see in the OR. This is what maybe Henry Ford should let me come on and see at the request. But it's just amazing watching it with a physician and seeing how true that. Now she's not saying it's perfect. Now there are some things that it gets wrong, but ultimately, when we're thinking about putting ourselves in our other people's shoes and clinician shoes and things like that, from her it seems like a good window to do that. But sadly, with that, Kathy, I got to say a giant thank you, Melissa. Thank you.
Hey, well, thank you guys.
Yeah, and
Appreciate
to our fam
that.
out
And
there.
for everybody watching, go ahead.
I was going to say, just to our fam out there, we love
Sorry about all
these
these Wi-Fi
founders.
issues.
We love these founder stories. Kathy, thank you so much. They inspire us. They help us get through the hard times.
And
Thank you.
we've got a big goal here. I think we're at like 70 or so LinkedIn followers on Hope Power Healthcare. Help us get to 150, please. Go follow Hope Power Healthcare on LinkedIn, and when we get to 150, then we're going to be able to deliver a lot cooler stuff and cooler content to y'all. So really appreciate the togetherness, and yeah, as a reminder, you don't have to go and do this alone. Kathy, thank you for sharing your story.
You bet. Thank you guys. Have a great afternoon.